Meeting will please come to order. What?
102, I took it down. It needs a battery.
Oh, 102. Our clock is down. It needs a battery. I'm sorry.
Where's our clock?
Yeah, I Shelley took it down because it's wrong. Counselor Taylor, would you like to?
Sure. Heavenly Father, we thank you for this opportunity to come together to meet the needs of the Cherokee people. We pray that you'll be present in this meeting, that we will conduct ourselves in a manner that is pleasing to you and that is helpful to our citizens. We pray that you will keep your hand of protection on our servicemen and women, both here and abroad. Keep them safe as they keep us safe. Go with us as we leave this place. For it's in your name we pray. Amen. Amen.
I'll have to do 2 roll calls today for everybody that was in a 2019 election. I'll do a separate roll call, and you can let me know if you're here and if you want to be a part of the meeting. So, Mary Baker Shaw.
Aye.
Mike Dobbin.
Here.
Harley Bezer.
Here.
Joe Bird.
Aye.
Hayden Duncan. Mike Shambaugh.
Here.
E.O. Smith.
Here.
Denise Taylor. Here. Victoria Vasquez.
Aye.
And Keith Austin.
Who? Yes, yes, and yes. Don't yell not to bother me during that.
Here and yes.
Sean Crittenden.
Here, yes.
Joe Deere.
Here.
Rex Jordan.
Yes, yes.
Darrell Legg.
Yes and yes.
Weston O'Fire.
Yes and yes.
And Dora Petskowski.
Here and yes.
We have one.
Thank you. Okay, approval of the minutes. Has everybody had their chance to read the minutes?
Make a motion they be approved.
Second.
Motion made and approved and seconded. All those in favor say aye.
Aye.
Opposed, same sign. Motion's passed. Okay, reports. First up, George Valerie. Valerie. I hope I'm saying that right. Valor. George, welcome.
Oh, George is good. That's.
I did.
I think you have my report in your packet. Collections are doing well. We, like I said, I think last month we were projecting to collect over $30 million this year. The big news is we opened up the emergency room remodel. We opened that up. Staff, it was hard to keep them out of there while we were finishing up and doing the last minute details. So that's open. Things are going well back there. So that's the big news. Any questions?
Any questions for Mr. Valier? Yes, Councilor Austin.
Can we come take a look at it?
Oh yeah, anytime.
Okay.
Anytime. We're up and running.
Okay.
Yeah, come by.
I'll stop by.
Come on, I'll show it to you.
Mr. Valier, are you going to give us a tour of the new ER sometime?
I will. Drop by, and I'll be glad to take you back and show you around. It has changed the logistics. Now to get to the emergency room, we're getting everybody to come through the back door. It's secure, more secure there. Those back doors are locked. You can register. There's a waiting area in the back. There's bathrooms. There's vending machines. Everything's right there at the back door. So no need to go around the hospital 2 or 3 times. It's all right there. Real convenient. Very convenient.
Wonderful. Congratulations on getting that open.
Thank you.
Any other questions? We really appreciate you coming down and sharing with us. Thank
Enjoy
you. Okay, Dr. Steve Jones. Good afternoon, Dr. Jones.
Afternoon.
How are you today?
Doing well. How about you guys doing all right? All right, I want to share a few things first. Notes here out of the way. All right. First, I'd like to thank all of you that took time out to come to our orientation that we had for half a day and split it. Those of you that did not make it, Dr. Councilor Shambaugh, Duncan, Councilor Crittenden, and Councilor Coates, I brought you a handout or a handbook that has all the information we went over. Hopefully those resources will help you. If you have any questions when you go through them, please get with me, and I'll be glad to sit down and explain anything that's in there. It's all the slides that we went through, and also on the back there's some resources of different contacts that you for different departments. Okay. If you have any questions, please let me know. Hopefully that was valuable to those of you that came, and everybody learned something. I know we did, and we enjoyed having you come out and spend time with us. So. And the other thing I want to talk a little bit about that is we kind of went over this a little bit in that meeting, but whenever you call us and you need help with something, some of the things that we would like to have is the current contact information for that person. Sometimes they haven't updated a chart in a while and the contact information isn't accurate if they've changed cell phone numbers or something like that. So if you'll give us the current contact information, the patient's name, date of birth, specifics about what it is that they're having issues with, and then give us a little bit of information about what you would like us to help you with. That'll help us to meet that patient's needs and not spend time tracking down things that you may already have access to that we don't. A lot of times if we don't have a correct phone number, then we can't contact them, and we may have a name, and but we can't get a hold of them. Then we have to track one of you back down to find out if you have a correct telephone number. So if you'll give that information to us, it'll help us to help you. Okay. All right, let's move into the report. The first page of the report, we had some best of Tahlequah and some people that got recognized. Of course, our hospital got recognized, and then Dr. Jasmine Baker as an OBGYN, Dr. Deborah McAllister, who is a orthopedic surgeon for us, and Dr. Doug Nolan all got recognized in the best of at Tahlequah this last month. I want to make sure we recognize them. On the next page, you'll find the vacancy rate is at 5.9% currently. That's something that we've talked about several times, so I just want to point that out and keep that on the radar. Our approval rate on contract health, you'll see, is 96.6 this month. That's a little bit down from the month previous. I think it was 97.5, so it's down just a little bit, but it always fluctuates between 96 and 99%. So then on the next page, you'll see that all of our ambulatory visits across the system were up for all the different clinics. That's usually this time of year because it's school's getting back in session. People are doing all the things right before school starts back. So this is an August report, so you'll see all those visits tend to go up right before school starts. And then on the last few pages, you'll see diagnosis by clinic, and that breaks it down to the top diagnosis for each clinic that's in your district. So you can see what the main things we're dealing with out there. Next thing I want to talk about is the progress at the outpatient health center that we're transitioning into currently. We have started moving some services over. They are all non-direct patient care services that are currently moving in now. We have a time transition of as equipment and desks come in, then we're starting to move people over to get them acclimated to their new space and make sure IT is working, phone systems are working, and kind of doing some testing with that with those transitions. Our direct patient care services are due to start moving over on October 7th. And on October 7th, we're going to have PT and OT, physical therapy and occupational therapy, dental, behavioral health, audiology, optometry, WIC, a portion of radiology, and a portion of lab and pharmacy. That's our goal for that first week in October 7th. Those teams are going through processes right now called Day in the Life, where they come into their area and we have mock run-throughs with patients so they can find the obstacles that those patients may encounter prior to actually having patients in the building. So we're going through those transition exercises now to get a little more ready so we can clear out as many obstacles as we can before the patients actually enter the building, and trying to identify those things that a patient may encounter that may be difficult. October 21st, we're shooting for primary care and resident clinic to start to move over. Those are being driven They're a little bit behind, but we've got a few construction things that got in the way, so we had some equipment that we're waiting on to show up, so that put us a little behind on those two. But we're looking to the October 21st deadline to start moving those services over.
Did you give us a proximate on when we are going to have an opening?
I don't have that. That's something that the chief's office will be deciding when that.
You think we'll do a soft opening, then the initial opening?
Yeah, and that's what doing these service lines in first is kind of that soft opening, so we're not just putting a whole lot of patients in the building at the same time, and trying to identify where those where we need signage, where we need what are you going to be seeing when you come in the building. So and identifying all those little obstacles that you don't really think about until you're there and doing it. So we're trying to get those things out of the way preemptively.
Okay.
May the chair recognize our chief of staff?
Speaker, if I could try to
Absolutely.
answer that. We would like to open these up, as Dr. Jones said, and get patients flowing in and out of there. It won't be obviously the entire building that will be operational on the October the 21st. Then we'd like to see where we are with the rest of the facilities, but I would imagine sometime in the late November, early December timeframe is kind of our target to make sure that we're ready, and then we'll have the grand opening then. But hopefully during the next council meeting or this health committee meeting, we'll have a better update and let you guys know what day we have for an official grand opening then.
Okay.
Thank you. Thank you.
All right. Stillwell Construction. Trailers are in. I guess you've seen that.
Yes.
They're getting all the utilities hooked up. They'll start building the decking that connects everything and makes it where people can go from one trailer to the next seamlessly. We're supposed to have our pharmacy inspection this week, the end of this week. They'll come down and look at the trailer we're going to use for pharmacy and make sure it's secure and do all the things they need to do to certify it. And then we'll go through the certification process. So we're in the process of moving through that, those items that we have to do in order to move the pharmacy. Parking, we have talked with CNI. They are moving a lot of their services to the south end of town, so that north parking lot is going to be a little less clustered than it was before, so we should be able to utilize that, which is a lot closer to the clinic. So we're still looking at some different options there as far as I've asked Ms. Harris to start looking at staggering openings on different departments so that we don't have everybody rushing at one time to try to get on the shuttle that takes them to the clinic.
Growing pains, that's a good thing. And Ms. Harris sent me a note or two, kind of keeping me in the loop. I appreciate that.
All right.
Anyone with any questions?
I've still got a few more things if that's okay.
Fire away, Dr. Jones.
All right. One of the things that we're looking at, trying to get a baseline on patient time cycles, on when patients come in to us, how long they are at each spot as they stop through the process. One of the things that I wanted to show you is this is the form that we're using. It's hard to see probably from there, but this is given to the patient when the patient comes into the clinic. And each one of these areas, there's a place for a time to be written in and initialed. So the patient is going to hold us accountable on when they go through the process. So when they check in, they sign in, they put a time down. When they check out, they put a time down. When they leave the clinic, they turn this form in for it to be put into our analytics, our data, to be able to give us the time frames that they're at each individual stop. Okay, so we've got a process working to try to identify if there's places we need to improve, or if in fact there is issues out there, or there are not issues out there. So we're going to get some average time cycle done so we can share that with you guys. Okay. You asked me a couple of weeks ago, or a couple of committee meetings ago, about collection letters that we use for contract health whenever we have someone that gets contacted by a collection agency. This is just a copy of that letter that goes out to that collection agency from the Cherokee Nation. So I know you guys were waiting on that, and I failed to get it to you electronically, so I just passed it out to you today. That pass around. All right. Another issue that came up just this weekend, I got notified about a patient portal issue. We have a patient portal that allows patients to go in, look at appointments, look at making appointments and canceling appointments and other patient information. And that we encountered some issues with that, with the cancellation and the making of appointments. So it was taken offline because of the bugs that they were working through. As a result, the ability to see future appointments was taken down also. They worked through that issue, and as of this morning, the ability to see future patients is supposed to be back up and running. I don't know, I haven't checked it myself, but I was told it would be back up and running this morning, so people can see future appointments on their patient portal. We're still working through some of the issues with being able to schedule and cancel patients through the portal, because we do have a unique system. It's not the same as a lot of other systems, so it encountered some difficulties and people understanding where they're making an appointment and where they're canceling an appointment, so that we're not confusing the system and taking up patient space that maybe should be allotted to someone else. So we're working through those issues, but the being able to see your current appointments that are scheduled should be back up and running.
Very good.
All right, so the last thing, and I don't know if you want me to talk about this now, Madam Chair, or do you want me to wait on the resolution? You want me to go ahead and talk about it now?
We could go ahead and talk about it now.
Okay.
Certainly.
Okay, I just want to
Wait,
explain.
Do I need a motion to amend the agenda if we're not talking about it in committee?
It's not really on the agenda until you amend and have it placed on, so.
He's talking about the resolution.
We discuss it.
Why don't we go ahead with our questions, and then
Okay.
at the end of this, we will bring it in.
Good.
Okay, any questions for Dr. Jones? Counselor Austin?
Very simple, but this is dated September 16th, and it still has the old chief and deputy chief on the corner of
Yeah,
it.
it's a form that they gave me out of Contract Health. I actually got it before, and I just hadn't got it to you. So this is mine, but yes, it has been updated for what goes out.
Good.
But this was sitting on my desk, and I failed to get it to you before when you asked me for it
I appreciate
2
that.
council meetings ago.
Okay, Counselor Crittenden?
Yeah, just something I thought of when you were talking about some of the departments opening up a little early, and what's our plan in place, you know, if an elder goes to Hastings where they normally go, and then they're gonna send them to the new place, which is quite a ways. Do we have some side-by-sides or something that will?
Well, I'm not sure about the transportation issue, but I do know that they're contacting all those, and they've built out the schedule so that they're notifying patients.
Oh, okay,
You will be
beforehand.
going to this facility, and this is where you'll be going for this appointment at this time. So we are working on through all the transition piece of that and notifying the patients personally, not just a sign.
All right. Thank you.
Okay, Mike, Counselor Shambaugh?
Really just an observation. I really like what you've done with these two forms, because that's two of the biggest things that I get approached about is, you know, waiting times, or, you know, contract health. This has happened, it hadn't been paid, or there's a late bill, you know, they've been billed 2 or 3 months later, and now they're getting dinged by collection agencies. I think this is great, just so we can see, is there a place on there, if they leave for any reason, if they don't stay for their, if they're there at 9, they're supposed to, and they leave at 10 or 10:30, is there a place that shows that they left and they didn't stay for their?
If you're talking about if a patient left,
Yeah.
I'm sure that they would turn that in to us. I mean, we're accountable to them, so it's up to them to turn it in to us at the end of their appointment. So if they left and they were upset or they just didn't have time to stay, they can
So would
turn
that
that
be
in.
logged anywhere on
It would
there
be-
that they
It would be
left?
logged in there, yes.
Okay.
As a incomplete visit, and, usually there's a place for them to write in what happened. We're really looking at appointment times from scheduled appointments,
Right.
because walk-in appointments obviously are going to be different.
Sure.
To see if we're doing a good job with our scheduled patients first, and then we'll take it from there and go to the next step. But we had to have a baseline to start somewhere.
Right.
And
Well,
this
I
is
think it's
a start.
It's a great start. I think that's good. One other thing, just want to kind of give a thank you to, and just say, Mr. Carey, every time I've called you, you've been very prompt on things, and I think, you know, you really help a lot of people, and I just want to say thank you, because, you know, there's a lot of upset people, and after you deal with them, you know, and explain things, and obviously you have a way to talking to people, they come back happy. So that's a big thing for us too, and I just want to say thank you for the job that you do. I know it's a difficult one, I know it is, because they don't understand the process sometimes that it takes to get something paid. And you do a good job explaining that. I just want to say thank you.
Counselor Buzzard, did you have a question?
Yes. Dr. Jones, the clinic director at J, is she still interim?
We have opened that position up we've advertised that
Okay.
position.
So
So
it is open.
she has been encouraged to apply for it, obviously, so.
Okay. The other thing, I've had several patients contact me, and I know, because I use the clinic on a regular basis, that it's quite a walk from that parking lot to the front door of the clinic. I've had some patients, an example, a lady goes in and has a surgery on the knee, but she drives herself to the clinic by herself, but it's difficult for them to walk from that parking lot up to get into the clinic. I wish we'd take a look at that, because it is quite a walk.
It is, yeah.
I know we have a lot of handicapped parking places up there, but still, even those are quite a ways. But it was brought to my attention that at one point in time, they was going to put a cart up there. Don't know if you are aware of that, or maybe before you come in, but if you would check on that and see, because I've had several of them that had complained about the walk and getting in up there, because it's just difficult for them to get out of the car and walk up there.
Okay. I'll check into it, see what's available.
Thank you.
Counselor Crittenden?
Yeah, just follow up. So where they write the time in, that's just appointments right now?
It's actually, we're trying to do everybody that comes in that's willing to help us out, and it's being, you know, given to the patient in a way of, you're going to be helping us hold accountability and
Emergency
finding.
room and clinics and all.
And the outpatient clinics, it's being done, it was actually completed a couple of weeks ago. We're analyzing all the data and getting all in spreadsheets now. The hospital is currently being done, so we expanded it in the hospital because there's a lot more services. So there's several other departments that are being included in that service at the hospital, and I haven't seen any of the data yet on it. So
But the emergency room was?
the emergency room, I'm trying to think I don't think we included it in this first one. It's going to be included in the second one, but I think urgent care was.
And the walk-ins, you mentioned maybe later?
Right,
Do the
because
walk-in.
walk-ins are worked into around appointments in most of the primary care and pediatrics and things like that. So it's hard to come up with a specific time on those, because it depends on how many of your regular patients show up and how fast you move through them, so that because they work them in. But it will help us to identify where we have some shortages and what we can do to fix those.
I think that's a real good step.
Yep. We think so.
Counselor Piskowski?
And in the clinics that you've done this in so far, is it just for a time frame, a day, a week, how long?
We did it for 2 weeks.
2 weeks.
And we did it for 2 weeks so we could get a good sample, and then we can identify what things we need to look at, and then after we make a few, recommendations or changes or whatever we need to do, then we'll go back and do it again to see. So right now, we're just trying to get a baseline of where we're at to be able to identify what things need to be looked at.
This Counselor Buzzard.
Yeah, Dr. Jones, can you tell us how many doctors or physicians or providers have we lost in the last month?
I can't tell you that off the top of my head. I don't know the number, if there are any that have left in the last month. I don't have to get with recruitment and see. They track that, but I'm not aware of anybody that has left in the last month.
Have we employed more doctors now in the last month, or do you keep up with that?
I get a report from Ms. Whitcliffe, and unfortunately, Dr. Montgomery's not here today, but he would be the one to report on that, because he stays in touch with provider recruitment, and he usually is the one that gives a report on that.
Thank you.
Okay.
Thank you,
But I
Madam
can
Chair.
get that to you. I'll try to send you something electronically.
Okay, Counselor Shambach.
I had one other question, I'm sorry. I've had a couple of calls about, and I don't know if this is your area or not, but the behavioral health clinic at J. They have one, I guess, doctor or
Provider, yeah. Mm-hmm.
Is that normal staffing? Are we down, or is
It is normal staffing for that clinic, but we've identified that she is seeing an inordinate amount of patients. So we know that that's somewhere we need to improve, and we've already started looking into that for the 2020 budget, at moving some resources around to support her.
I think there was like 40 on the waiting list.
Yeah.
So yeah, that's pretty busy.
And I know Ms. Skinner is working on a plan to try to spread resources out for places where we're a little bit heavier, that we need to move resources around a little bit. But we're looking at it from an overall picture, not just looking at it clinic by clinic.
Right.
Because in the past, things have been siloed, and when they're siloed, one person may put a lot of emphasis on that, and they have a lot of resources, but the need isn't as high. And then over here, it may be a higher need, but not many resources. So we're looking at how we can spread our resources around to be consistent throughout the whole system.
I can tell you that one of the people, they were suggested that they go to Salina, and they did, and they came back and said they got right in. So that was good of them to refer them else, and they went, and they were very happy with their experience there. So. Yeah, so it is, that process is working apparently. I was going to tell you that too.
And our plan is to get it more stabilized, so it's not so siloed, but it's going to take a little time to do that. It's just now starting to look at it from a system-wide instead of clinic by clinic, and trying to change that perception of how administrators look at it.
And I think in today's times too, I mean, this mental health is turned into something that's kind of just blown up too.
Yeah.
In the past couple of years, so that's something that we'll have to grow with. It's good to see that you're planning for that. Thank you.
Anybody else with any more questions for Dr. Jones?
Sure. Dr. Jones, there are some changes that's taken place since you have come on board. Could you give us maybe a draft of who your directors and maybe assistant managers are in these clinics, and then at Hastings, so we kind of have an idea where the changes have been made?
Absolutely. And
I wouldn't want you to do each position, but just the upper echelon of who the decision makers are.
Absolutely, and we're in the process of changing that a little further to try to, again, look at it from a system-wide standpoint instead of individual clinic standpoint. So we're in that process currently, and as soon as it gets finalized, I'll be glad to share that with everybody and give you the names and contacts of each person, what they're going to be responsible for. So we're taking an approach that would allow patients to get the same services no matter where they are, with the same, hopefully with the same amount of resources surrounding those services.
One more thing, I saw where we were in the top 10, Oklahoma, Alabama, and Louisiana is ranked ahead of us, and you probably think I'm talking about football. And they are ranked ahead of us. Now I'm talking about obesity. So we're tied with Texas on number 10, and that's in adult category. So appreciate you working with Lisa Pivick. I know we're trying to improve that, and I think we've come a long ways because we are not growing as fast as other states. So that was a good thing that I read.
And we're unique because we have public health integrated into our health system. That makes us unique. That's why the CDC was so interested in coming and looking at us, because that's unique to our health system. A lot of public healths are separated. So with those, that ability to collaborate with different types of programs, it's going to, I think we have an opportunity to improve that.
Thank you, Madam Chair. Thank you, sir.
Dr. Jones, I have a couple of questions. But first off, I want to thank you for that amazing orientation. For anyone who did not go, what an opportunity you missed, because it was outstanding. It took, I guess, 3 hours, 3 out of the best hours I've spent since I've been a council member, and I really appreciate the efforts that you went through and that your staff went through to make that possible for us, because it was fantastic. I learned so much, and I really appreciate the book. And if you all don't have that book, it's full of a wealth of information in that book. Thank you for thinking to do that. We really appreciate that. I want to ask you a question. Do we have physicians at all our clinics?
Yes.
Including Nowata?
Yes.
Okay, I'm glad to hear that. Tell me, this patient portal that we had the problem with, would you like to expand on perhaps why that went down?
There was some issues with usability and the ability to, the limits on canceling and making appointments were not consistent. And so we need to, they're working on setting some limiters in there. So for example, if someone wanted to, they had a outpatient surgery scheduled, we want to know more than 15 minutes if someone's going to cancel that. So if someone got online and canceled it 10 minutes before their surgery, obviously the team is ready to go and that person didn't show up, and so there's limits we can put in there that that would not allow that to happen. They would have to make a phone call if it's within a certain hour frame. And so they're working on getting those limits put in place, and when they took it down to be able to work on that, unfortunately the other part, it was all part of one package. So once we had identified that we had taken something down that was useful, then we were trying to get it back up while we're still working on the other pieces to get them, honed in to where they're useful, and where there's some limiting factors that someone can't accidentally, maybe if they have multiple appointments, cancel one that they didn't intend to cancel, or make an appointment with someone they didn't intend to make an appointment with because that's not their primary care physician. So we've got to make that a little more user-friendly.
Well, I want to tell you, I applaud the efforts in technology that we're using now to help our patients. And I know that there may be some growing pains, but I applaud the efforts that we've got going on toward this. I really do. I want to ask you a question. Recently, there's been in the news that veterans can go to an emergency room, and that emergency room can bill Veterans Affairs. Are we doing that currently?
We have been. We've had an agreement with the VA for a while that we are seeing our patients here, and then we do get some reimbursement for that. But it's not just an emergency room, it's in other areas also.
It's in other areas also. Well, I'm proud to hear that. I'm all for helping our vets. I think that's all. Are there any other questions for Dr. Jones this time? Excellent report, Dr. Jones. And we're going to come back after the other reports and amend the agenda for the motion that you're talking about, okay?
All right. Sounds good. Thank you.
Thank you so much. Excellent. And now we'll hear from Cherokee Nation Home Health and April Moore and Cherokee Nation Hospice. Is April here? Okay.
Madam Chair, we were unable to get in contact with them to make sure we were double checking to see where they were today. I apologize, and if it's okay with you, I'd like to get in contact with them and sit them down and find out what happened, and if it's appropriate with you guys to have them come back to the next meeting.
Next month would be wonderful.
And I apologize for that.
Well, I know that Pace, Thelma Pittman's here. Yes. It's always good to see Thelma. Hi, Thelma. How are you?
Good.
How are things going at Elder Care for us?
They're going really well. We managed to take a loss to a gain, so we're sitting at 180,000 gain instead of a loss right now. We have 180 participants. We thought by October we would have 183, but a couple of them backed out, so we're still going to have 181 come October. Our management team is in discussions about having an open house and inviting the council. We want to make sure that happens soon, and we did forward you guys a floor plan. I think Ms. Miller should have that. I think we did that at your last request. We have 67 employees, and 67% are native and 33% are non-native. Our participant load is 49% Caucasian, non-native, and 49% non-native, 49% native and 51% non-native. It varies back and forth. It usually stays right at 50% on both sides. So we are planning a conference call with our contracted vendor for our feasibility study for our Muskogee site, October 1. We're going to kick that off. And that's just about everything going on at Pace.
That's exciting news. Does anyone have any questions?
Do you have a a rough date where you might do your open house?
No, sir.
Because our fall really gets busy.
I know it does, and I know our management team is working. In fact, we're going to have a huddle when I get back, hopefully today, and I will sure bring that up and make sure that we get something planned for everyone.
Just get back with Shelley or Gail.
Yes, sir.
Okay, thank
We'll do that.
Anyone else have any questions? No, but it sounds like exciting things are happening there, especially with the expansion over in Muskogee.
Yes, good things are happening.
Tell me, how big is that facility projected to be in Muskogee?
We want to do around 20,000 square feet, and we're working with our folks that have been there for a while to try and make everything more accessible and make sure that we're using every inch of space that we can use instead of, we just want to make sure that it flows well for our folks. And this one has, the one that we have now is working very well. We've managed to do some tweaks and it works well for all of our participants.
20,000 square feet, how many patients will that provide room for?
I think probably at any one given time, we'd have to work with the Muskogee Fire Department to see what occupancy is. But with our facility right now, which is around 15,000 total, including our admin building, I think it's 138 occupancy at any one given time. So
that is quite a few. Did I understand that in your report you had 181 patients in occupancy?
yes, but not all of them are in the building at the same time. It depends on their care plan. Some folks come 5 days a week, some folks come 1 day a week, and some come once a month. So
wonderful. Councilor Dobbins, do you have a question?
Yeah, tell me the Muskogee locations at Three Rivers. Is that
yes, sir. That's what we're anticipating. Yes, sir.
It'll be on the south
Side.
property.
Yes, sir.
Thank you, Chair.
Any other questions? Thelma, thank you for coming and sharing.
Thank you.
This is a good report. We appreciate it. Thank you. Okay, since Ms. Moore is not here, I am going to entertain a motion to amend the agenda. Councilor Shambaugh?
We had no old business.
Oh,
but
wait,
we do that
any new business and any old business?
No old.
Any new business, yeah. Okay, then I'm entertaining a motion to amend the agenda, and Councilor Shambaugh, will you take that?
I'll make a motion to amend the agenda to
Thank
add
you.
this as item 1.
Get this right.
Second.
Okay. Councilor Shambaugh, will you entertain that? Okay, thank you, Councilor Taylor.
This is a resolution authorizing the submission of a request to the Indian Health Services to participate in the 2019 Joint Venture Construction Program Agreement for renovations and operations of the Tahlequah hospitals and clinics. And I put that in the form of a motion, and also it needs to go to full council tonight.
We need to vote on the motion to amend.
Okay. We're going to entertain a motion to vote on the amendment. All those in favor, say aye. Aye. Okay, and since Councilor Shambaugh has read the amendment, all those in favor of supporting the resolution, say aye. Aye. Same sign. Okay, and it will go to council tonight. Thank you. Okay, so the next regular scheduled meeting is Tuesday, October 15th at 1 p.m. I'll entertain a motion to adjourn.
So moved.
Second.
Thank you.